Pressure ulcers, also known as pressure injuries or bed sores, can cause a lot of problems. Billions of dollars a year in increased patient care costs, patient pain and suffering, and in 60,000 cases in the U.S. each year, even death. For hospitals, they can cause financial loss and damage to their reputation. We know what pressure ulcers cause, but what causes pressure ulcers? That's what this video will help explain. And we'll show you how Mepilex border pressure ulcer prevention dressings from Malnika can significantly reduce the incidence of pressure ulcers. To understand the causes of pressure ulcers, we need to understand what we call the four factors. Four extrinsic factors which come from the external environment and not from within the patient are interlinked in the formation of pressure ulcers. They are pressure, friction, shear, and microclimate. Number 1, pressure. Pressure is easy to understand. It's the weight or force applied to the skin surface. This force compresses tissues and cells, causing cell damage or cell death. But despite the name pressure ulcers, it's not the only factor that matters. 2. Friction. In the simplest of terms, friction is the rubbing of two surfaces against each other. Without friction, you wouldn't be able to walk down the street, sit in a chair, or hold your coffee cup. But when it comes to the formation of pressure ulcers, friction is a very bad thing. For example, let's imagine a patient in a hospital bed. The patient wants to sit up to watch some TV or have a snack, so we elevate the head. Gravity begins to pull down on them, increasing pressure against the bed, and as they slide, friction between their skin and the bed keeps their skin in place while the tissues beneath the skin continue to respond to gravity and pressure from the patient's weight. 3. Shear. Let's look at our patient again. Gravity is pulling down, increasing pressure against the bed, and causing friction as they slide. If the friction is too great, the skin stays in place. Gravity is still pulling the weight of the patient down. This pulling can stretch and deform the cells beneath the skin. This is shear. Shear is particularly present in the area of a bony prominence, like the heel or sacrum. The combination of pressure, friction, and shear causes stretching and displacement of the underlying cells, called soft tissue deformations. These deformations are believed to be a major cause of the most expensive, dangerous, and reportable pressure ulcers. So pressure, friction, and shear are interlinked when it comes to pressure ulcer formation. But there is a fourth factor, microclimate. Microclimate refers to the temperature and moisture present between the skin and the bed or support surface. Moisture can weaken the skin and increase friction. Increased temperature can also weaken the skin and increase the likelihood of skin damage by external forces. Because all four of these factors can occur simultaneously in real life, you can't predict which will contribute most to a patient's pressure ulcer risk. That's why it's important to reduce all four at once. The best way to do that is with a pressure ulcer prevention dressing, specifically engineered to combat all four factors. That's why Malnika developed its deep defense technology. Malnika's Mepilex border dressings are unique in this regard, with layers designed to work together to protect against all four extrinsic factors at the same time. When you select Mepilex border sacrum or heel dressings with deep defense technology, you're choosing products with the most scientifically and clinically proven effectiveness, reducing pressure ulcer incidence by up to 88%. And that's a relief not only to your bottom line, but to the millions of patients who suffer from bed sores every year. Don't just take our word for it. See the proof for yourself.